And that is a subcuticular stitch, and proxy strips can be placed across the surface if needed, but frequently they are not needed. Proxy strips or steri-strips are used for minor superficial lacerations that do not warrant suturing. And this is usually the case when a wound has almost no tension on it, and the approximation of the wound is easily obtained. If this is the laceration, to apply the steri-strips, I have cut these down to size, and one simply applies one end to one side of the wound. Using one's finger to press the wound together, you apply the opposite side to the opposite side of the wound with excellent approximation. Now, it's important to remember that the wound needs to be treated appropriately prior to the closure. If it is dirty, it should be cleaned with anesthesia if necessary. With relatively minor wounds, a tissue adhesive can be used. These are cyanoacrylic glues. Dermabond is one of the makers. The cyanoacrylic glue works well for lacerations that are relatively minor. They're not on mucocutaneous borders. They're not heavily soiled wounds. There's no human or animal bite involved, no infected wounds. And they're not over the elbows or knuckles or any areas of marked stress, unless these are going to be immobilized. Now, once this is completed, it's okay to get it in a little bit of water, but you don't want to soak it in water. It's okay for a gentle bath or a shower. Now, as with any other wound, hemostasis is important. The wound needs to be cleansed, needs to be dried, and then the wound margins need to be approximated. Now, if any of the glue gets inside the wound, then you pretty much have to start over again, clean the glue off. The capsule is squeezed. The glue is then allowed to soak the tip. And then the wound margins are approximated, and the glue is brushed back and forth with the wound margins approximated, giving several seconds in between. Now you can see that it's now soaked to the end of the tissue. And just a few seconds in between to allow it to dry each time, or to almost dry. And each time the glue is painted back and forth, an extra layer is applied. And after approximately a minute, enough strength exists that you can release the wound. You want to keep the wound horizontal to the ground so that there's no dripping. And the wound is then held together for approximately a minute, and then it can be released. The dog ear repair is a technique used to repair the so-called dog ear scar that results from sutures that are placed cumulatively farther apart on one side of the wound as compared to the other. Some degree of undermining is usually important. For the dog ear repair, here is the excessive tissue. To remove that, we will make an incision essentially in this direction. This. Then one needs to undermine, and then one needs to pull the excess tissue over the incision that has been made, and you can now see the part of the tissue that has to be removed. This excessive tissue, essentially all of this that has been colored on this side. Now that can be removed either with a scalpel or with an iris scissors, and then after that is done, it is simply sutured down. Now I'm going to exaggerate the cut to demonstrate how this can now be pulled together with simple suture and there is no excessive tissue. Although Z-plasty is not a procedure that I expect many people will perform in the primary care setting, it is an important procedure, and I'm going to demonstrate that. Z-plasty is used to correct the axis of a laceration. For instance, if there is a laceration that is over one of the joints, the knees, the elbows, the joints, and the laceration is in the long axis of the extremity, then when the scar retracts, it can restrict movement. The Z-plasty procedure actually changes the axis of the scar to almost 90 degrees so that there is no longer restriction in movement. Let's assume that this is the original laceration in the long axis over a joint. If this constricts with wound healing, there'll be decreased movement over that joint. So what you do is to make 2 incisions, each one beginning at the end of the laceration. These angles are decided by the angle that you want to end up with, the angles of the final scars as compared to the parallel line. Now once these are made, you then undermine each of these 2 flaps and then simply reverse their location so that the original margins of the laceration are now on the outer parts of the Z. And now, as you can see, there is no line that is parallel to the long axis. They are now 45 degrees to 60 degrees perpendicular to it. When these constrict, there is less constriction along the long axis. Elliptical incisions are not commonly used in the primary care setting or the emergency department. They are excellent for removing crushed, devitalized tissue, stellate lacerations, or lesions such as moles. To perform this elliptical incision, the length or the long axis should be in the direction of the creases or skin lines, and the length should be approximately 2.5 to 3 times the length of the crushed, devitalized tissue or the lesion. This way, the entire problem is essentially removed and you result with a nice, clean incision that is easily sutured. Assuming that the red area here was a mole, or if all of this tissue was devitalized by crush injury, by making an elliptical incision along the blue line, one can remove all of this tissue, resulting in a very clean laceration. Now again, you want the long axis to be approximately 2.5 to 3 times the length of the mole or lesion that is being removed. And again, this is not a procedure that would normally be performed in the primary care setting. It's a fairly simple procedure and worthwhile demonstrating. And this is how most moles that are larger than one that can just be scraped off or cut off are removed. So once this is removed, this wound can now be converted to a nice, neat laceration with the wound margins coming together, and it is now just a straight laceration that can be closed fairly easily with simple interrupted sutures. Tongue lacerations are sutured only if they are gaping, large, and gaping, or if they result in a forked tongue. In general, most tongue lacerations that approximate well are treated purely with symptomatic care. Children like popsicles. It feels good and does no harm. These usually heal well without any treatment other than observation to make sure there is no infection. When treating fingertip avulsion lacerations, if the avulsed segment is less than 1 square centimeter, then treatment can be merely closure with adaptic or xeroform dressing. If you do this, let the patient know that it's going to take weeks for this to heal. If the avulsed area is greater than 1 square centimeter, then plastic surgeons believe this should be closed with a graft, and obviously you would call a plastic surgeon in for that procedure. This is a sterile disposable suture set, and I'm going to demonstrate how to set this up in a sterile manner without assistance. In the primary care setting and frequently in the emergency department, your staff is too busy to assist you, and it's a fairly simple procedure. Once the tray itself is opened, keeping everything sterile, you then put whatever you need on the tray. Your suture material. I like the Zero Wet Splash Shields. At this point, you put on one sterile glove. And this allows you to have one hand to touch anything that is sterile and the other hand to touch that equipment which is not. So that you can use your solutions. I like betadine and the normal saline or irrigation fluid, whatever that may be, and the local anesthetic. This is all easily performed without any other help. You then insert this into the sharps container. You put on your other glove, and now you are all set to do the procedure. Several needle devices have been made to decrease the chance of needle sticks, and this is one type. It looks a little bulky, but it's actually fairly easy to use once you get used to it. Just like any other needle, when it's added onto the syringe, it's used, and then once it's finished, it's capped like this. And there's no way that you can stick yourself with it. It's a completely safe needle at that point. A wound check for signs of infection should occur 2 days after the suturing. The reason for the 2-day period is because it has been shown in studies that lay people are very inaccurate in diagnosing infection. Also, if an infection is going to occur, it usually does occur within 24 to 48 hours. As you know, the signs of infection include redness, swelling, heat, pain, pus, and possibly red streaks. The treatment depends on the etiology of the infection. If it is simply a stitch abscess, then removing that one stitch may resolve the problem. If it is underneath the scab, then sometimes removing the scab, deroofing it, and cleansing will remove the infection, and the underlying skin is healthy. Nothing else needs to be done. If the infection is deeper, then sometimes all the sutures need to be removed, cleansing needs to occur, and antibiotics if indicated. There are essentially 4 times when you should consider calling in a plastic surgeon. The first and most obvious is when the patient requests it. If a patient strongly desires a plastic surgeon, that patient is not going to be satisfied with any procedure you do, no matter how perfect. The second is when suturing the laceration would be beyond your capabilities. The third is when you have any doubt. At that point, it would be a good idea to call the plastic surgeon as a consultant. You may pick up some ideas that give you enough information to perform the closure satisfactorily. And the fourth is when there are time constraints. If you're in a situation where your duties require you to do so much in so little time, then a plastic surgical procedure may not be possible purely because there's no time to do the procedure. Possibilities for dressing the wound include: 1, no dressing at all. This is fairly common for facial lacerations. 2, some sort of antibiotic ointment such as polysporin. I do not use Neosporin because of its reactivity. It can cause an allergic reaction. Third possibility is probably the most common for the trunk and extremities, and that's covering the wound with a non-absorbable gauze. Some people like having some sort of antibiotic ointment underneath the gauze. When removing a suture, remember to pull across the wound rather than against it to avoid undue tension on a newly healed wound. Remember, it takes about 6 months for a wound to mature. So if a patient is not content with their cosmetic result, they should wait approximately 6 months prior to having a secondary plastic surgical procedure. Hepatitis C, similar to hepatitis B and HIV, is one more reason to practice universal precautions when you're suturing. Although it may take 10 years to develop, it is frequently fatal due to hepatic carcinoma and due to cirrhosis. It is usually a progressive chronic disease. Approximately 50 per 100,000 healthcare workers seroconvert per year, and the chance of seroconversion from an HCV positive source is approximately 4 to 10%. We've reached the conclusion of this suturing technique program. It is my hope that this has and will continue to help fine-tune your suturing skills. I'm Dr. Robert Goldweber. Thank you and good luck.